America's silent crisis. Alcohol is claiming more lives than ever before. It's a paradox that's hard to ignore. Fewer Americans say they're drinking alcohol these days. But for those who still indulge, the dangers have reached unsettling new heights. Here's the shocking truth. Over the last 2 decades, the number of alcohol-related deaths in the United States has nearly doubled. A trend that should alarm us all. But what's really behind this startling surge? And who is being hit the hardest? Let's unravel the data and the controversy swirling beneath the surface. A deep dive into disturbing trends. Researchers at UCLA recently pored over extensive data from the Centers for Disease Control and Prevention, investigating alcohol-induced deaths from 1999 all the way through 2024. What they discovered is nothing short of alarming. The death rate related to drinking shot up sharply, with the most dramatic increase striking during the tumultuous period of the COVID-19 pandemic. Even though there's been a slight drop since the pandemic's peak, the overall numbers remain stubbornly high. The study's authors are raising urgent concerns, stressing the immediate need for policies that don't just address overconsumption, but also ensure more people can access effective treatment. Their findings, published in the respected journal PLOS Global Health, shine a bright light on a problem that's often swept under the rug. But here's where it gets controversial. Even as overall alcohol use declines, deadly outcomes continue their relentless climb. How can this be? Unpacking which deaths are rising and why this isn't the first warning sign. Earlier studies also noticed rising alcohol-related deaths. But pinpointing exactly what types of deaths were increasing and whether pandemic-era spikes would become the new normal remained up for debate. To answer these questions, the researchers examined CDC records for 14 different types of alcohol-related fatalities. These included chronic conditions such as alcoholic liver disease and alcohol-induced mental or behavioral health issues, as well as direct alcohol poisoning. Here's what they found. Between 1999 and 2024, deaths directly attributed to alcohol skyrocketed by a staggering 89%. 2021 stands out as the deadliest year, with 54,258 Americans dying due to alcohol. And while 2024 saw the numbers plateau, the death rate was still a worrying 25% higher than it had been just 5 years prior. But this is the part most people miss. What's driving these numbers isn't usually sudden binge drinking. Deaths from acute alcohol poisoning stayed relatively stable and low over the study period. Instead, it's the slow, devastating effects of chronic, heavy drinking, especially alcoholic liver disease and alcohol-related mental health disorders, that are quietly shortening lives. Who's most at risk? The shifting demographics you need to know. Perhaps most eye-opening is how the face of alcohol-related death is changing. While men have always died from alcohol-related causes at higher rates, the new analysis reveals an unsettling trend. Women, particularly those aged 25 to 34, are now experiencing the fastest rise in alcohol-related fatalities. This was closely followed by men in the same age group. American Indian and Alaskan Native communities faced especially high risks, an inequality that raises tough questions about social and healthcare disparities. As Dr. Maria R. Dorsonia, the study's senior author, points out, the rapid rise of alcohol-induced deaths among women is particularly concerning. Although men still die at higher rates, the gender gap is closing fast. For young adults aged 25 to 34, the ratio. Is this closing gender gap simply a result of changing cultural attitudes toward drinking? Or are other forces at play? This is sure to spark debate. Beyond the obvious, alcohol's hidden toll. It's crucial to recognize that this research only captures deaths directly attributed to alcohol consumption. The real impact runs even deeper. Alcohol use amplifies the risks for many chronic diseases, including various types of cancer and heart conditions. Startlingly, other studies have suggested that excessive drinking is linked to more than 178,000 U.S. deaths each year, making it one of the leading, yet preventable, causes of death nationwide. So what's the best way forward? The researchers aren't shy about their message. Addressing this crisis requires more than generic warnings. Prevention and intervention efforts must be tailored, targeting not only men and youth, but also populations like American Indian and Alaska Native groups, whose vulnerability is too often overlooked. And this is where controversy really heats up. Should public health go further, even considering stricter alcohol regulations or advertising bans? Or is the solution more nuanced, lying in community support and better mental health care? What do you think? Are we paying enough attention to this silent killer? Or are we focusing our energies elsewhere? Could new, tougher policies curb this deadly trend? Or are there deeper societal issues fueling the rise in alcohol-related deaths? Let's hear your thoughts, whether you agree, disagree, or have a new perspective to add to the conversation.